The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Hey everybody, welcome to the premiere episode of It Takes Balls. I'm Stephen Crocker, a stage 2B testicular cancer survivor and board member with the Testicular Cancer Awareness Foundation. Today's guest is also a TCAF board member, an actor, a TV host, speaker, pilot, retired U.S. Air Force medic, and a 2-time testicular cancer survivor. BJ Lange, thank you for being here today.
Thanks, Stephen. So great to be here. Hello there to the TC world who's tuning in.
You are way more charismatic than me, and I love it.
No, this is good, man, because that means I can do a little color commentary and you can take things more serious. This will give me freedom to be a little bit more goofy. So it's perfect.
Perfect. All right.
Thus, this is also proof that it's different people who get testicular cancer, right? This is like it could be anybody out there.
Could be anybody. So let's get right into it. Let's start with give a little bit of your background and how you came to find that you had testicular cancer, because you had it twice, 2 times.
Correct. Yeah, I sure did. Well, my situation, I think, was a little bit different in that, one, I was 35 years old. I had enlisted into the Air Force Reserve, and I was gone doing some training on active orders for the military when in September of 2015, I realized that my left nut was slowly getting bigger. There was no pain. There was no, it was just a matter of enlargement for the most part. It was a little uncomfortable, but I wrote it off like most people at first. It wasn't so much of a denial thing, more so than I was saying, oh, I'm running every day. I'm taking supplements. I was in the military trying to keep up on stuff, so my body's adjusting. So for the first few weeks that I really noticed it, I just wrote it off. And then in September, again, of 2015, I went to the clinic, and one thing led to another, and then over to an ultrasound. And so at the end of September, I had a left radical orchiectomy to remove my left testicle. And then I did chemo in December of 2015. And then basically, I guess a year and 9 months or so in the summer of 2017, at this point, I had been placed on temporary medical retirement due to the cancer. I went in for a follow-up CT scan, and it had relapsed into my lymphatic system in my left aortic lymph nodes down in my abdomen.
So what was, like you, my left testicle was slowly growing, and I was afraid to go to the doctor because I kept looking it up, and testicular cancer kept coming up as a possibility, and I didn't want to see that. So I kind of just pretended that it wasn't happening. So when you noticed it, you said you were, active and healthy, and you thought it couldn't happen to you.
Yeah, that is exactly the truth, Stephen. When I tell you I was at the best shape of my life, that is an understatement. I mean, I was in my life, that was the pinnacle of my health, believe it or not. I was running 5Ks every day. Without even breaking a sweat. I was very proud of myself. So, and that's how a lot of my, journey with cancer affected me in multiple ways. As we all know, it's not just a matter of the physical cancer. There was a lot of a mental part too, because of my loss of work and things like that, and how it affected my military career. And it kind of just slowly crept into other areas too.
Let's dive a little bit deeper into the kind of diagnosis process. So when you first went in, when was the first time you heard the word cancer?
When I went in September of 2015 to the Troop Medical Clinic at Fort Sam, Houston, I don't think I heard cancer at that point. It was the physician's assistant who palpated and examined what I was there to present, just said, okay, we're going to put in an ultrasound. Never said, what it could be. So I was just like, okay, maybe it was an infection, something like that. It could, epididymitis, who knows? It could be anything, right? So I went to the ultrasound. I remember seeing the ultrasound results before I actually heard from any of the providers, and the actual terminology that they use, and I have it somewhere on my social media, you can see it. It says left testicle is approximately the size of a small orange. Okay, like that was the actual terminology.
Wow.
Okay. Now, that didn't shock me as much as what I heard here. And at this point, for clarity, I had not completed my nursing program yet, which I was in the middle of doing in my training to understand what this meant. But the next sentence said, right testicle remains unremarkable. And I was offended by that, to be honest, Stephen. I was kind of offended by that. But now I know what that word means. So I went to the ultrasound and got those results back. That led to me going to see the chief urologist at San Antonio Military Medical Center, what used to be Brooke Army Medical Center in San Antonio. And he examined based on those results. And he goes, that needs to come out. And I said, like, do we know what it is? And he goes, it's probably cancer. And I said, well, probably can't we do like a biopsy? Can't we figure it out beforehand before I lose this thing? And he's like, I've seen so many and that I'm aware, and you're going to, you could totally live with one. And I said, but what about a biopsy? Like, is that a feasible thing? And he goes, well, we could, but it could spread. And then I realized it. Before I really let all of that sink in, he goes, this is a training hospital. Would it be okay if we invited some of the other students to come in to kind of see it? And being a lifelong learner, I was also older, I was 35. I taught high school. I teach workshops in college. So like education is important to me. So I realized this is a good opportunity to possibly help another man's life. And I said, yeah, sure. Not realizing what I had opened myself up to. And before I knew it, there was about 13 young lieutenants who were going into urology, and they are all taking their turns, palpating me.
Wow.
Yeah. And this colonel who was the chief of urology, he goes, are you doing okay? And I said, sir, with all due respect, this is the most excitement I've had since basic training. So, but hopefully that, that really kind of helped people to get some experience. And he goes, we're going to schedule you for surgery. And I went, oh, great. Like, I'm right in the middle. I start my nursing program here in a couple of weeks. So that'll be the perfect spot for me to be able to do the surgery. And he goes, no, we're doing it tomorrow. And I had never been admitted to a hospital like overnight since I was like a baby, so I never had surgery. I've never been in this situation. So there was a little bit of like, okay, but it all happened so fast to me, and I was in such great health, and I, had faith in my doctors and in the system, because I'd already worked in the military medical field at this point. I was really starting to grasp what that would be like. So to be honest with you, it didn't seem like that big of a deal. It wasn't until my relapse where I think a lot of truth and life and my situation and really what a cancer diagnosis means. I didn't get that confirmation until, I want to say, maybe a week later, something like that. Like the first week of October, they called me back over to the hospital. And then that's when I was told by the urologist, yes, we got the pathology back. It is a testis cancer. Now, at this point, I was stage 1B, at least back then. Yeah, I believe that's what it was. But when I relapsed, obviously that meant that my initial diagnosis, it jumped up. And I want to say it was like 2C or something. I don't exactly remember. And there has been some talk over the last year, as a matter of fact, because I'm 4 years out from remission. I still have a year to go until I'm considered cancer-free. But I was talking to my hematology oncologist now at the VA in Los Angeles, where I'm at, and he believes that it's possible that my initial regimen of chemo may not have been enough. And that's actually why I relapsed. So that initial diagnosis could have been incorrect.
Wow. And it's just jumping back really quick. It's interesting that you say you had your surgery the day after you saw the urologist, because that was the same for me. I wonder, doing this podcast, if that'll be kind of a common thing that people just go right the next day.
Yeah. I mean, obviously the urologists know, and they want to, get it out of there. Why keep it in your system? Even if it is, but I know that was your initial point in asking me, Stephen, was, how did it feel when you hear the word? And it wasn't like I was scared at first. It was more of like well, what the hell am I going to do? How does this work?
Yeah.
And I also have to set the table here to tell the listeners that, like, I was in a point in my life where I was in training and I was focused on getting through my military medical education so that I can return to my part-time job out in Hollywood. That is my real life. This military thing, I was just doing it part-time, and I was just like, okay, great. Like, let's just do this next thing, because this affected me. I was only supposed to be gone for like 98 days from LA, and I was gone for a year because of this.
Wow.
So it really kind of, dug its way into so much more of my life.
Yeah.
Yeah.
Go ahead.
I do think that a lot of people are going to say pretty soon after either they were seen by a urologist or they got an ultrasound or whatever, that triggered that surgery immediately, would be my guess. I don't know. We'd have to talk to one of our docs to find out.
Yeah. Do you remember what your pathology was?
It was seminoma. Man, I should crack open my Testicular Cancer Awareness Foundation little booklet that I created. It broke everything down, and which, by the way, we have it up on the website. You can check out testiscancer.org if you would like to get one of these for you or a loved one who's been diagnosed with testicular cancer. It kind of breaks down everything and answers all the questions, so you always know, in case Stephen Crocker ever calls you to do a podcast interview and you need to remember everything. I should have looked at it before this interview, but yeah, it was seminoma. And like, I don't remember the precise sizes of everything as far as the tumor on my left nut, but it was the size of a small orange, according to that report.
That's pretty decent size. And, I've heard of, small ones, and I've heard of way, way bigger ones than oranges. I mean, it runs the gamut.
Sure. A friend of mine, Dan, who was really my first person that I ever talked to about testicular cancer, because I didn't know anybody other than like people that we know in the celebrity world who have been diagnosed, but I didn't know anybody personally that had TC except for my buddy Dan. And in his case, it wasn't his nut that presented with the tumor, but it had wrapped up around some of his organs in his lower abdomen. And when he got in a car accident and they did a CT scan, that's when they were like, hey, did you know you have testicular cancer? So yeah, different ways to present, I guess, with the same disease.
Yeah, that's interesting. So, okay. So talk about your chemo. You said that it wasn't, in hindsight, they think maybe it wasn't enough. Which regimen did you receive?
Yeah. So in fact, now I was, like I said, stage 1B at this point. I had just done the surgery, I want to say 2 weeks before, and I was presented with an option. So according to and I don't know if these have changed, but at the time, the NCCN guidelines were at this type of testicular cancer, at this staging, your options are surveillance. So I could just watch it and do nothing. I could do one round of carboplatin, or I could do a little bit of radiation. And I didn't have any idea what would be the best choice. So of course I got teamed up with a radiation oncologist there at the military, a hematology oncologist. And of course I was talking to my urologist, and I was asking them what all they would do, and answers, and you should do this, you should do this. So I really had to sit and think about it. So I did a little bit of research, and I was looking around, and of course that's how I came across Dr. Einhorn and hearing about carboplatin and seeing what they would do. My mom actually took my file, sent it over to Dr. Einhorn. He said, I suggest you do surveillance. So that was, to hear from an expert there, at least in the TC world, kind of gave me at least maybe not an anchor for an idea, but it presented, with more options on what I should do. I wrote down every day because I was still in training, mind you. It wasn't like I was just sitting around going, what am I going to do? It's twiddling my thumbs. I was trying to figure out what the hell I was going to do with my life. So every day I wrote down on my mirror, and I'm interested to hear like how people decided for themselves. I should also set like the demographic stuff here. I was 35, single, no kids, have a full-time professional acting career in Hollywood, part-time in the military. So how do I make this decision? I knew that if I did chemotherapy, like this is attacking all over my body and that I could get, really sick, or, I didn't really care too much about losing my hair because I knew it would grow back, even though my receding hairline is already starting to work its way down. So there was a little bit of that. The fear of both radiation and chemo, of course, is long-term effects. How would that affect me? And then doing surveillance, it's like, do I just do nothing and hope, or do I do something? And if there is something there that could spread, do I do that in the hopes of, nipping it in the bud? So I wrote down every day on my mirror, chemotherapy, and I would see it in the morning when I woke up. And then when I got home from school, I would see it, and then I would erase it, and I'd write, radiation. And I think it took about a week or so of me to decide that I should do the chemotherapy. It had the best results. So I did one round of carboplatin, which really doesn't sound too horrible. And to be honest with you, it wasn't that bad. And I think probably because I was in really good health. I ate really well back then. No judging. Donuts are delicious. So I did one round of carboplatin, and I noticed a few weeks later that I did have some side effects, believe it or not. So the platinum agent is known to have ototoxicity. So I did have a little bit of like tinnitus that was happening. Mind you, I was always around aircraft. I was in the military, so I was around weapons. So there could have been a mix, but from the time that I entered the military to the time I left, which is following post-chemo, I did have hearing loss. So I had high frequency hearing loss, and I currently wear awesome hearing aids thanks to the VA. And then when I relapsed in my lymphatic system, I went through radiation, and they chose radiation because of the side effects that I had from chemo. The first time I was already exhibiting nerve damage. And I can't confirm 1,000% that it was the chemotherapy, or was it, lifting patients all the time, and just military use of my body. I mean, who knows? But the small fibers, generally the neurologist is saying that's probably what was affected due to the chemotherapy. So it kind of frayed my nerves a little bit. So we chose radiation, and I did 28 days of radiation in my lower abdomen in 2017.
Talk about the radiation, because I don't have much experience with that. So, and I don't even know, is that something that they still do often?
Yeah, sure. Radiation therapy, maybe if there's some sort of contraindication why a patient shouldn't get chemotherapy, and of course consult with your providers and get their insight. But this was targeted to a specific area. I was a little worried that maybe, yes, of course. Okay, here's big picture BJ at the time. I get my relapse diagnosis following the CT scan. And I read it. I actually read it in the report before they even called me. I was like, damn it. Like, it came back. Like, I saw it. I was actually out at an Air Force Wounded Warrior event in the beginning of the summer. CT scan. So like the beginning of July is when I was notified. So I was up at Offutt Air Force Base, Nebraska, and I logged into my health report on the VA website, and I read this, report from the radiologist, and I went, damn it, like it came back. So, what was that going to do? And when I realized it was in my lymphatic system, that really scared me. And here's why. My stepmother at the time had relapsed her cancer, and she was not doing well. My stepmom had ovarian cancer, and unfortunately, a year later had passed away due to it when it went to her brain. But that's kind of your lymph nodes are all over your body, in your skin, which is the largest organ in your body. And in my mind, I immediately went to like the worst case situation. I catastrophized everything at that point because it felt to me like the boogeyman had come out of the closet. Because I really did think, oh, I'm gonna be fine now for the next 4.5 years. Like I'm gonna be cancer free. I will never see this again. Like it, because everyone was like, you got testicular cancer. It's the best cancer. It's so treatable. And yes, it is. But when you relapse, and I think you deal with it a second time, especially considering someone who like didn't really care about it the first time, it kind of was like, no, hold on a second now. We're gonna give you a little bit more life here to have to deal with. So radiation was pretty well, I guess instead of me trying to verbalize what it is, let me walk you through what it was like.
Yeah.
So obviously my mindset was I was nervous. I knew that I would have to be going to, I chose to have the VA do my radiation because at this point I had already established care at the VA. So I had a hematology oncologist who did not oversee this, but of course I was still consulting with him because of the previous diagnosis. And then my radiation oncologist, who is amazing, this guy, Michael Chung at the West Los Angeles VA Medical Center, is just fantastic. I mean, he was so helpful to get me to understand everything and how this was going to work. So I had to be scheduled to come in and do a sim, where they're going to do a simulation. So they're going to put me into the system. They're going to show me how I'm going to lay on the table. Here you go. This is a fun one. When you get radiation, you get tattoos, or you can get tattoos. So I never had any tattoos. Always wanted to have tattoos, just don't have any. So they said, hey, can we put 3 little dots on your belly and on your sides so that we can put laser spots on where it's going to target. So basically they don't have to guess. It will always be in the same precise spot, right? Mm-hmm. Let me heighten that situation with this. A side effect, just like chemotherapy and radiation, of getting those treatments is possibly cancer because you're getting more radiation, right? Like you're getting more, and that could possibly be a possible issue down the line. So I was really worried about my organs, in my lower abdomen. And I was told that I would receive a lot of radiation in my lower abdomen and that it could be possible that I could have liver or kidney failure in the future or issues from this. The most immediate issues I noticed were my guts, like my intestines. Those were really affected by the amount of radiation. Like I had terrible diarrhea, a little bit of anorexia because I was vomiting all the time. Your lymphatic strip on your abdomen, where I was getting targeted a lot for the radiation, led to a lot of nausea. And unfortunately, and I have to bust Dr. Chung's chops a little bit. And this was a total a fluke. Of course, he didn't do this on purpose. But when I went to do my first treatments, we were trying to set up ahead of time what my medications were going to be so I can be on top of everything. And of course, the nurse was putting it in. And I think he had forgotten to put in my Zofran.
Shout out Zofran.
Yeah, right. Shout out to Zofran because, and if you're not doing it, on the regular, like if I would skip one, like I would totally be feeling it. But he forgot. So that first night when I came home after it, I was puking like crazy. There's a video on my Facebook for that. of me doing that. I was trying to do stand-up comedy while vomiting. Anyway,
wow.
I was trying to make the best I could, Stephen, with the situation.
Yeah, you'll have to send a link. We'll have to link to that in the description of the podcast.
Good. I'll send it to you. So the setup in the simulation, they got a target where it's going to be because they want to try and pinpoint it at all angles. So this, and I don't know the technical terms, so I apologize to anyone out there who is a radiation therapist. My apologies. I'll just say the machine. I know there's tungsten on the other side that like grabs the beams or whatever. But anyway, this machine is going over me at a precise pattern, which is blasting down radiation to hit this enlarged lymphatic area. And cut to like, I don't know, week 2 or something like that and I'm going every day, Monday through Friday to go do this. I was getting very tired. I had a part-time job that I was working at the time, my part-time actor job, the day gig, as we would say, that unfortunately I was so sick, like I couldn't work that part-time job because I was going to treatments every day. So like, I'm going at 8:00 in the morning to the VA, which is far from my house in LA as far as traffic is concerned, because it's LA. And then by the time I would get done and drive home, I would either be so exhausted or I would be so nauseous. Just the idea of me trying to then, and I did for a few weeks. I was going to work every day, my doctor's like, what are you doing? Like, are you working? Yeah, I got to work. I can hear my dad's voice in my head. You got to work, son. You got to keep working. And it just wasn't a good idea, because why on earth would you want to be driving a company vehicle and be Mr. Excitement, which was kind of my job at the time, being Mr. Energy, while I'm going through this? It wasn't good. So I got put on temporary disability through the state, which is similar to like an FMLA, different situation. But basically I got put on that. I forgot where I was going with this, Stephen, but I ended up for like week 2, I came in to go do the radiation treatment, and I lay down and I put my hands back and I hold on to the things like I always do. My belly's exposed, and the lady, the machine is inside of a room, just like X-rays, right? Where they need to shield it because there's radiation being beamed. So like this door is like this thick, it's like 1.5 foot thick, and they walk in. It's like, if I could only hear and I couldn't see, and I hear them open the door, because you could feel the air in the room go, as they open the door. Like, I feel like I would be on a spaceship, or, like they should be walking in wearing spacesuits, the therapists that come in. So I'm holding on to this thing, right? I'm holding on to the machine, and I'm ready. And they're saying, okay, here we go. And they always try and play like nice music, as if your mind's not going, I'm totally getting radiated right now. Like, they're trying to play like nice soft rock, to like ease the tension, because your mind's going nuts. And I'm laying there, and I know the machine, the process, because I have, for the preceding 14 days, I had seen it, and I memorized what it does. And for 3 minutes, I'm getting radiation, but it takes a few minutes to wind up and then turn off. And I'm laying there, and it's been like 7 minutes, and I can hear stuff, but it doesn't seem right. And I'm thinking, oh my God, they are cooking me. Like, I am getting cooked on the inside. And I said, hey guys, like, am I going to die on the table? Like, what is going on? And over the speaker, they're like, oh no, Mr. Lange, we had to reboot the system. I'm sitting there thinking like I'm dying.
Wow.
So that was interesting. You can, afterwards, I felt it. It's not like I can feel it immediately blasting through me. It's not like, I don't feel like a bunch of heat and all that stuff. But afterwards, like my skin, I got burned a little bit, some dryness in the area where I was targeted, and just dealing, I think, both with a lot of the unfortunate diarrhea, because my intestines, they got so much radiation that like the inside of your guts, like your intestines are catching food as it passes through. because it's kind of like scar tissue, I guess, inside your intestines. So it kind of, I was having discomfort. I was dealing with a lot of nausea. Obviously I was puking quite a bit. So like that Zofran was my best friend. And that was pretty much it. My mom flew in from Texas to come help me the last, like, I don't know, probably 2 weeks, I guess, of my treatments. And so that went from, I started radiation therapy in August of 2017, I think, until like maybe the middle or end of September 2017, something like that. So around that time period.
Talk more about, you said initially you were working and, you chalked the tinnitus up to being around aircraft, and then you eventually were put on what you kind of likened to FMLA.
Sure.
When I went through it, my doctors had said, one of the best things that I could do, and mind you, I work a very low, not very strenuous job, but they said, keep with routine as much as possible. So when you did have to stop, how did that impact you?
As far as the chemo or the radiation? When you had
to go on the leave.
Okay. So at this point, and again, going back to chemotherapy, when I was on active orders, that I took convalescent leave of, I think, of like 2 weeks to like just kind of reset my body. And then I came back and finished my training and did some clinical rotations. So like that was all good. Of course, I got put on temporary medical retirement from the military, but that's a whole different discussion on how that affected me. But going forward into 2017 in my relapse and the radiation, the problem that I was having was I worked a job without saying what it is here for the interview, but I worked for a company where I had to be super energetic, enthusiastic, fun-loving, and that's who I am as a person anyway. But I was going through this treatment, which was making me tired. I was dealing with fear, and a lot of the mental health side of things really started to kind of come out, from the periphery of this whole journey that I never really dealt with at this level. And I knew that I needed to take care of me. And so when I talked to my doctors and I said, hey, I should say when I spoke to my doctor, and I said, I'm dealing with this. And he was like, yeah, like you're working. And I mean, there were days where I was driving and I was so tired from the radiation. I mean, it just wears you out, that I pulled over on the side of the freeway to like just take a nap, or just hang on for a second, just in the hopes that I can make it home. And then what am I going to do? Change clothes and go to work? Talking to them and having the ability to be able to go on this leave was very helpful for me, because my job at that time really was to take care of myself on top of, and I'm not just talking about doing radiation. I'm still talking to my hematology oncologist. At this point, I was still, this is maybe a year and a few months since I had officially come over to the VA to take over my healthcare. So like I have neurology appointments. I'm talking to my primary care. At that point, I had so many doctor's appointments that when my mom came to come visit me, and the VA always says, would you like a printout of your appointments? I normally put it in a digital calendar anyway, but just for fun, I'll print it out so I can make sure I got them all on my calendar. And she goes, oh my God, there was 2 pages full of upcoming appointments. Some, of course, were the radiation therapy, but everybody from acupuncture to, I just had so many appointments that became my job to go to take care of myself as far as medical stuff is concerned. And then eventually things kind of eased up, and yeah.
Yeah. I mean, you got to listen to your body.
Yeah. You really need to advocate for yourself. And that's something that I think a lot of people don't realize when they deal with something like that. parents, especially like, you're so used to taking care of kids, or in my case, like I'm a wonderful advocate for everybody else. And I love taking care of my patients. I still work in the pre-hospital care setting now, and I love taking care of my patients and advocating for them. But oftentimes I find myself not being the best advocate for myself. And that's something that I'm still learning.
Yeah, I agree with you. Except I don't work in a hospital.
That's it. Soon. You want a job? Maybe I'll get you a job.
Let's do it. Okay. So as a comedian, I mean, did that help you at all? I mean, you talked about when you were talking to in the early stages, when you had the 13 people checking you and you had that remark. I mean, is that something that helped you get through and to cope?
I think so. So there's probably different levels of how comedy influenced my journey. On the one hand, just me as a person, and I think this is really because of my family and the way that I was raised with my brothers. Humor always found its way to be able to break the tension or something that's awkward. If you ever work in law enforcement or as a first responder, EMS, fire, I notice, and some people will say, and veterans, that we have a dark sense of humor, and some more dark than others. But I will say and people get that confused with the ability to be able to crack a joke when things get uncomfortable, to be able to break the ice as a way to like smooth over everything and open communication. Notably, what comes to mind for me in this, so that I could share a little bit of an experience, I was working as an Air Force medic at SAMC, San Antonio Military Medical Center, which was a level 1 trauma center. We had a woman that got hit by a car. She came in, and I remember after this very traumatic patient, and she's wheeled off to the OR, myself and a few other medics were cleaning up the trauma bay, and it's always a mess after something like that. So, and there was a lot of younger folks in there, and I was older, I was 35 when I was doing this. So, people weren't talking, I think it was a very serious situation. We had seen something that we probably didn't expect to see at that level. And I cracked a joke in there, and it kind of just, not only did it make everybody laugh, but it was like, it opened the lines of communication of, everybody laughs and, oh man, like that was crazy, huh? Yeah, no kidding. And it gets the opportunity to do that. So I think my comedy, not only as a improviser and as a comedian in the acting sense, and that is my personality, but I think also the theory that I teach and that I have been professing for so long. So I teach improv comedy, and in improv, we have 2 words, and those words are yes and, right? That's kind of the base theory, the kitchen sink rules of improv. And when my cancer relapsed, I really needed to go back and remember what I had been telling these people for so long to be able to move forward. There were days where I didn't want to get out of bed, and I was very depressed, and I was mad that like I was sick again, and like that I felt like crap because I'm not working my job, and then I'm not going out on auditions, and I wasn't spending the time that I need to be able to submit for jobs and do the whole business of show business that I do every day because I was sick. And so that depression sunk in, on top of the fact that I was dealing with stuff from my employer, which is a whole different discussion. But so I was dealing with all of this, and I needed to go back and say, now, wait a minute. You tell people on the daily that in improv, we say yes and, but I'm not yes anding myself. I'm not accepting this reality so that I can take care of myself and say it is okay where I am, and then put one foot in front of the other, which is to say and say, okay, good. It's okay. Yes, this is happening to me. And today I'm going to do this. And today I'm going to do this, and slowly working my way back up. But as far as material comedy is concerned, I went from, because I occasionally do stand-up, I went from talking about just observational stuff to probably about 80% of my material switching to cancer comedy and really talking about living life with one nut. Because although truly I don't care that I have one nut, it is a good way for me to not only be able to deal with it myself and all of the things that come along with a testicular cancer diagnosis and having an orchiectomy, but it also opens the mind of the audience to maybe knowing a little bit about testicular cancer and be able to advocate that way. So comedy definitely changed because of my cancer diagnosis, but I think the cancer diagnosis really made me a better comedian because now I have a different filter to be able to see through, a different lens to look at things that I didn't have before.
That's great, man. You're killing it. So let's segue from there into what you're doing now. You're on the TCAF board. You moderate the virtual conferences, etc.
I try to do whatever I can, Stephen. I'm like my ex-girlfriend. I get around. I'm just trying to make things happen. So obviously I came across TCAF. I met Kim Jones, the founder of TCAF, and I heard her story, and her connection with her son, Jordan, and his unfortunate passing, but her advocacy really spoke to me. And I always wanted to help out in any way that I could. Of course, now testicular cancer was very meaningful to me. And I said, well, all right, well, maybe I could serve on the board. I'm also good friends with Mike Craycraft over at the Testicular Cancer Society. Mike, in fact, was the first person who I would consider to be like a subject matter expert when I got my diagnosis, because my friend Dan, who I was talking about earlier, connected me to Mike. And, through him, I went to a conference with TCAF, and that's where I met Kim. And so many things happened because of this diagnosis, not just serving on the board, but helping to build up the conferences, moderating, like you said, or when we do the in-person conferences, I'm happy to MC if Kim would like me to do so, or I should say, or the board, whatever the board says. But meeting so many other people and opening so many different doors into testicular cancer, and let me tell you this, had it not been from my cancer diagnosis, one, I may just be a regular Air Force Reserve medic having this part-time job, but I got enrolled into the Air Force's Wounded Warrior program because of my diagnosis, and I became the comedy coach for the Air Force Wounded Warrior program. And in that program, as part of the resiliency programs, I teach wounded, ill, and injured service members how to use improv comedy as a healing tool. So on one hand, like I teach at the Second City, we teach, improv from more of a performance standpoint. But there's, as we all know in the arts, you can learn so much more from an art than just performing or just doing it. What is it that we get from this art? So I teach applied improv comedy specifically to try to gather and strengthen life skills for folks who are going through a lot of similar situations. Although, I might be working with a wounded, ill, and injured service member, or even a caregiver who had been in a traumatic accident. Maybe they lost their leg in a motorcycle accident, or they got blown up on a deployment, or they themselves are dealing with some sort of mental health trauma. I could still use the skills of improv that I love and adore, and that will continue to study for the rest of my life to help people that way. So both the comedy and the laughing, but really the team building, the trust, the camaraderie, that kind of stuff. And so I continue to do that too. And through this cancer diagnosis, I serve on the Artist Council for the Armed Services Arts Partnership, which is fantastic. And I'm a co-founder for Mission Warriors, another nonprofit that helps military and veteran communities use healing arts as a way to be proactive against, situations such as like we discussed. So it's been a wild ride, and it's so weird to kind of step back and see everything that kind of came from a diagnosis. So if you're out there and you're dealing with a cancer diagnosis, it's very easy for us to say, and it still is for me. Don't get me wrong. I'm not saying everything is, peach pie and vanilla ice cream. Like I'm not saying everything's great, because there are still days that we all struggle and that I still continue to deal with stuff, but it's very easy to say, well, what the hell did this happen to me for? Instead of saying, why did this happen to me? Ask yourself, why is this happening for me? And that really helped me to say, holy crap, like, look at all of these opportunities that happened because I was diagnosed with cancer.
That's awesome. You took my next question out of my mouth. I was going to say, do you have any advice for anybody facing it? But I think, you nailed it right there.
Well, and you hit it earlier too, Stephen. You got to be an advocate for yourself. I think that really is a big one. I was single. I don't have any family out here in Los Angeles. I got a ton of friends. My improv community, my improv family really, were with me during a lot of this. But yeah, I think having a good community is going to be important, and, advocate for yourself, and don't be afraid to think about self-care as another doctor's appointment, something that you have to do to be able to take care of yourself. Because it's easy to be like, I'm just going to lay down and watch TV. And that could be, therapy for some people, but maybe there's a way to apply this in a way to change your thinking, try to help you out. I really got into like meditation and practicing mindfulness. I'm not saying I do it all the time, and I'm certainly not great at it, but I'm trying to be better at it. I'm working on it slowly.
Thanks so much for being the first guest. I think this was a great first episode. Where can people find you?
If you have questions, if you want to reach out, if you just want to share your experience, I'm all about it. Of course, Testicular Cancer Awareness Foundation, we have an awesome testicular cancer support group on Facebook. If you're not on Facebook, we are trying to see what other options might be out there, but reach out to me and keep in touch, because I'd love to connect with anybody, whether you're a patient, a survivor, a caregiver, or even researchers. We like to keep that research option open to folks who are trying to understand what this is, so that they can advocate for people, whether they're researching on the science side or if you're a provider. On Facebook, on Instagram, Twitter, I'm on all of those. At BJ Comedy is my username across most of them, but BJ Lange on Facebook is my page. So looking forward to talking to all of you. You can email me at bj@bjlang.com.
Got your own website with your own email address, man. You are killing it. Hey, thanks again, man.
Thank you, Stephen. I appreciate what you're doing, and keep fighting out there, everybody.
For more information, visit testiscancer.org. You can also follow us on social media at Testis Cancer. We're on Facebook at Testicular Cancer Awareness Foundation.